All right, welcome everybody to Your Healthy Self with Regan. And today it's going to be a very, very special show. We've got an exciting friend and guest and colleague and partner on the show, Dr. Scott Frogley. And so you're going to learn some things about how to keep your spine corrected and your structure upright. And you're going to learn how to promote longevity and reduce pain and inflammation in your body in ways you've never imagined. And so before we begin with the show, I want to just check in with everybody and welcome. Many of you are coming on right now, but I want to see how everyone is doing on their hack. So last night we had your Health Accelerator challenge, and that one was to get more protein in your diet. So look at your overall body weight, and depending on the levels of activity that you have, we gave you the challenge to eat at least a gram of protein per pound of body weight. And if you're very active, then a pound and then 1.5 grams. And so this is part of our fat burning challenge that we're all engaged in. This was week 9. And so if you missed that, go back and listen to the recording. But yeah, I want to see how everyone's doing on that, because it was a very fun challenge. And we talked about some healthy sources of protein, some healthy sources of resistant starches and carbohydrates. So if you're not part of our hack community yet, our Health Accelerator curriculum, you want to get on that. This group is growing every day. We're 500 plus strong, and really fun to have these weekly meetings. So without further ado, let's jump in, and I'm going to introduce Dr. Scott Frogley. And Dr. Frogley is one of the few humans in the world that literally has chiropractic care in his DNA. So he grew up, his father wrote the curriculum for Palmer College. When he graduated from Palmer College, Scott eventually ended up going to the same school. And when he graduated, he came back to the University of Utah. He was the University of Utah team chiropractor. And then eventually he went out and started his own practice, which we're going to talk about today, called Integrated Wellness. And Dr. Frogley, not only does he have incredible skills when it comes to looking at the body in a completely different way, but he's also been able to utilize areas of spinal correction, treatment of scoliosis. He utilizes the Peptides system in his practice. And he is someone who has now brought in the advancements in Western medicine and brought it into practice. And Dr. Frogley and I have partnered up. And so we are now official colleagues and partners, and it's so fun working with him. So Scott, welcome to Your Healthy Self.
Thanks, Regan. It's absolutely a pleasure to be here. And I want you to know that I did eat my protein.
Good. You're on track.
I'm on track.
Good. Yes, you got to follow the hacks every week. So good. What are your thoughts on the protein challenge? I mean,
I think it's amazing. It's interesting when you really look at, I always teach my patients that, the number one, thing that we need to be putting in our body, what our body is made of, is water. Second thing is protein. And it's interesting when I see people aging, and even my brother, I had this conversation with, he was just not eating protein anymore. And he goes, I just don't digest it well. I go, you need the protein. You just got to find a better digestible source of protein, which it sounds like you're giving. And I think so many of us just, you hear me talk a lot about posture and staying up against gravity. In fact, you've heard my quote I love to say is that, gravity is to our spine what plaque is to our teeth. We are fighting gravity every day. And if we're not fighting gravity every day, gravity is breaking us down. And so it's really has to do with our structure of our spine, and then how much muscle we have that's holding us up. So if we're not eating protein, if we're not developing muscle on a daily basis, gravity is just going to crush us. And that's a big reason why we have pain. So we'll talk more about that. So I'm a big fan of protein.
Yeah, it's good stuff. And we talked about, getting some enzymes, even apple cider vinegar, so you can get the digestion going to break it down. I think a lot of people, they stop short. They say, oh, I get bloated when I eat protein, or I just don't feel good. And it's like, well, that's a digestive issue. It's not a protein issue.
Right. Yeah, that's true. And I had my apple cider vinegar this morning as well. So.
Look at
each, brother.
Love it. Well, this is really exciting to have you on the podcast here. And so let's talk a little bit about kind of your evolution. I mean, you basically grew up at chiropractic college. Your dad was the academic dean and created the curriculum there. But maybe you could share with our listeners your history and your story and just about your family is kind of very interesting to me.
Yeah, I'll keep it short because it can go on forever because it's a big family. My dad was an FBI agent actually out of World War II. He had a master's degree and went into the FBI to make money to go to med school. And my mom had developed severe scoliosis and was really having a lot of back trouble. In fact, after her second child, so many complications with the birthing process that they told her she couldn't have any more children. It would potentially paralyze her or even take her life. And for some crazy reason, my parents wanted to have 12 kids. I don't understand it, but they wanted 12 kids.
That was the magical number.
They only had two. 12 was in their brain there. So they, back in the 50s, and they had a friend of theirs that said, well, why don't you take her to a chiropractor? Back in the 50s, my parents didn't even know what that was. They were in San Diego, and my dad found a chiropractor, took my mom. It made such a tremendous change to her that, to make a long story short, he decided not to go to medical school, but to go to chiropractic school. So he went back to Iowa, enrolled in school. In the process, the son of the founder of chiropractic, so BJ Palmer, was the president of the school. My dad enrolled. He had a master's degree. They hired him to start even teaching before he graduated because of his master's. And BJ died, and then his son David Palmer took over the school, and so the grandson of the founder of chiropractic, and he ended up making my dad his executive vice president. And so my dad was right there at school as they developed the curriculum, as they really advanced chiropractic. My dad was a huge part of that. And but the cool story is under chiropractic care, my mom actually had 8 more kids. So there's 10 of us. She didn't make it to 12, but she got to 10. And there's 7 boys, 3 girls. All the boys are chiropractors except for one. We kicked him out of the family. We don't let
Banned.
He actually went to 1 year of chiropractic school, but he was an FBI agent before he went to chiropractic school. So we all went after my dad. Now I've got nephews that are chiropractors now. We have just this massive family of chiropractors. It's just crazy. So, but it's fun. We have quite the family reunions, as you can imagine. So.
You guys have chiropractic tables at your family reunions, and are there adjustments going on?
Guaranteed. So, but my whole life has been around health. It's all I've known. Our conversations around the dinner table were health. It's just all I've ever known. And to watch my mom had very severe scoliosis, and so I also have gotten into the treatment of scoliosis, which is really such a varying postural deformity. And if we can help scoliosis, we can help the average person with back pain and postural issues. And I think the biggest problem that we have is really understanding why we have back pain or where it's coming from. And that's why most of us don't know how to treat it properly or prevent it, because we don't even know why we have it. Why did it happen to us? And it really is understanding gravity and what gravity does to us. And in that postural breakdown that we all experience, through life. And that can be the result of trauma. We can have a car accident. We landed on our head as a kid on a trampoline, and then our posture begins to change and develop. And, I always teach patients that our joints aren't designed to wear out. I mean, our joints really are designed to last a lifetime.
Yeah.
When we're eating, and this is what you teach better than anybody, that when we're eating inflammatory foods, we're creating this inflammatory process. And then our joints are designed, as they're not designed to wear out, but they're forced to function in an abnormal structural position to where then gravity begins to tear them down and break them down. And so again, if we're not constantly battling gravity is just going to tear us apart. Then you take and you add inflammatory foods and all of these poor things. We're all sitting at our computer all day and we just beat ourselves up. And so we end up with people that are blowing out discs. We got facet joint arthritis. We have all these issues that just plague us, and we just hurt everywhere.
Now, and this is, once again, back to your quote, which I love, is, gravity to the spine is like plaque on the teeth. If you don't do things to mitigate the plaque on your teeth are going to decay a lot faster, no different than the joints in your body. And when you're eating all these pro-inflammatory foods, then what happens is your joints start to get inflamed, and now you got friction in the joints. So you're constantly, you don't have that cushion to fight against gravity. And
Yeah, and I think the important message is that if I can go to the dentist and I can have them clean my teeth and I'm like, woohoo, I'm done. I don't ever have to brush my teeth again. No, nobody would think that way, right? We brush our teeth and we take care of that every single day. If we didn't, our teeth would fall right out of our mouth and we wouldn't have it. We had to put wood ones in like back in the old days,
George Washington, yeah.
But the same thing with our spine. We can go to a chiropractor, get adjusted, all of these things, and go, hey, I'm better, and then not do anything about it. We need to be doing something daily, every single day. I just did my exercises this morning, and it needs to become a daily routine that we do something to fight gravity, that we're working our postural muscles, that we're eating proper amounts of protein to strengthen our muscles, to give the building blocks, for our muscles to heal and to grow. And then we need to be working on that daily. And that's where so many people fail. We get so caught up in just pain. Well, I'm sure you've talked about this on our program, that pain is just inflammation, and pain is the last process, right?
Yeah.
Symptoms will show up at the end. So we just pop a few pills, we reduce the pain, we cover it up, but we don't stop the structural breakdown. We don't stop the daily wear. And, unfortunately, we have this mindset: if I don't have pain, hey, everything's great, I'm fine, right?
Yeah.
And the problem shows up when the pain shows up. It's like the heart attack, heart problem shows up when I have a heart attack. Before that, right? We got to change, first of all, the way we think. That's one of our biggest issues, is we get these thought processes that just don't serve us well.
Mm-hmm.
They cause daily wear, they cause daily issues.
Yeah, and so I think that's a really important point, because the mindset is the biggest thing, because so many patients have come into our clinics and they say, well, I'm pretty well, I'm healthy, my pain, it's manageable, and you guys were able to knock it down, and I feel good. And then they walk out thinking everything's okay. But how much malfunction has to show up in the body and disease before pain ever shows up in the first place?
Yeah, you got to lose, if you look at a joint, you got to lose like 60 to 80% of its function before you're going to even notice the wear over time and the symptoms showing up. And that's why, if we just sit around and wait and we're not proactively working and treating, I did my exercises this morning not because my back hurt. I did them this morning because I want a great quality of life. I know what posture's about. I know what structure. Gravity is crushing me.
Yeah.
I got to keep working against it, and I will until the day I die. I mean, I will do things to strengthen, keep my head over my shoulders. One of the worst things we can do is we're all walking around looking like this, taking that thing down, and it will continue to take it down. And
Yeah.
we notice one day, man, my posture is really bad. Well, yeah, gravity wants to get your head over, it wants to take it to the floor. So
Yeah.
and that's
Yeah, we
where
have big old heads on our shoulders, and we're upright beings. And so in order to circumvent that, now we got phones, and so everyone's walking around with their phone, and I can't tell you how many people downtown I've almost hit because they just walk right out into the road and their face is buried in their phone. I'm like, that's dangerous.
Imagine how exhausted you'd be walking around carrying a bowling ball out in front of you.
Yeah.
I can't hold this up anymore. Well, that's what your body's doing. You can't hold your head up anymore. And then the mystery of pain. Why do I have all this pain? It's such a mystery. It's not a mystery. It's what gravity's doing to you because you're not aware of it. So really, as we look then, if we can understand why we begin to have it, and it's interesting if we look at posture, lots of it starts with repetitive things we do, but trauma we had in our past. I can't tell you how many people I talk to. Have you had any trauma? No, I've never had trauma. How about a car accident? Well, yeah, I had a car accident 5 years ago.
Yep.
Or yeah, what about the kid? Well, yeah, I bounced on my head on a trampoline, or I got thrown off a swing set and landed on the ground, but I was fine. But that causes trauma. That causes adaptation as our body tries to balance against gravity. One of the interesting things is our body's always trying to keep our eyes level to the horizon. That's how we balance. Notice if you close your eyes, you get a little off balance. So if I did something to get my eyes off balance, I'm not going to walk around like this. I'm going to adapt my posture so my head's level, but now my shoulders are crooked. So my body's going to reorganize its posture below my head to keep my head level. So, people will come in and they'll say, I'll do a history with them. I have neck pain, back pain, pain down my leg, and I look at their posture. I can see exactly why they have the pain. I can see the structural issues that are there. I can see where the unlevel shoulders, the unlevel hips, gravity compressing these pinched joints, and if you think about those pinched joints, if I'm pinching on the left side, pushing forces up my disc to the right side, the disc swells and causes pain down the other side. It all is gravitational loads on the spine. And so, having a proper structural weight bearing x-ray, having all these things. When we go get an MRI, we lay down, we let muscles relax, we let ligaments relax, and we can see that a disc is herniated or swollen or inflamed. But when we stand you up against gravity and we load the spine and watch the posture adapt and change, shoot an x-ray of that, I now can begin to see the gravitational forces on the spine, where compression, why things are wearing and degenerating, and begin to understand it.
Yeah.
Then we have to figure out how to change it. And that's where the integrated process that we've developed at Integrated Wellness, I think, Reagan, I think is far superior than anything you'll see in any healthcare facility.
Never seen anything that comes close.
Yeah.
Absolutely.
So I guess let's segue to that if that's cool.
Yeah, because and right now for the last couple of months, we've had a lot of our patients go in, get their spines x-rayed, their knees x-rayed, their shoulders, I mean, their whole body. And it's so nice to have that type of perspective. And then we've got Dr. Knight internally, who's been able to help so many of you. And if for those of you who have not done that, you need to call the office and we'll get you the address to Integrated Wellness, because now that's part of our whole fleet of services here.
Yeah, and just a little background on Dr. Knight, he actually ran my rehab for 8 years. And I mean, he ran the whole thing. He was the man in charge and he worked for me, and he's such a great, great doctor. And I've had the privilege of working with him, and he's such a driven guy. And what a positive person to be around.
Man, and we've got nothing but like amazing feedback, and so he's been incredible. Yeah, you're right. He listens really closely. He's very skilled for a new practitioner, for a new doctor. I mean, he hasn't been out of school more than 90 days.
Forever. I mean, he ran mine for a long time.
Yeah, he went into school more advanced than the graduates who were teaching him.
School was just the formality part. He had a lot of the skills prior to that.
It just allowed him to take the boards. That was all school did. Yeah, he's phenomenal. So make sure you go see him. But the interesting thing about this, and when I saw there's an opportunity to work with you, I mean, for those of you who don't know, Scott and I have been friends for years, 10 years, 12 years. We've always ran in the same circles. We've spoken on the same stages. We've been leaders in our fields respectively. And then we finally, but we're not, I hate to call us competitors, but in a sense we were, you're doing your thing, I'm doing mine. And we've always wanted to work together and do something bigger. I have just the utmost respect for your skill set, your knowledge, and not only that, but just your ethics and your values. And so when there's an opportunity to come in and partner up with you, I was like, this is amazing. And not just for Integrated Wellness, but for these other services, and we'll talk about that, because there's that percentage of patients who we just haven't been able to help in our career. They have very severe back issues, very severe knee issues, and they want to still avoid the surgery. But sometimes when we move them too quickly into our repair and regenerate phases, we don't do enough to remove the inflammation. And so what is it that made you realize that it's time to start working with pain interventionists?
That's a great question, and I appreciate all the accolades, because I feel the same way about you, Reagan, as you know that, and just total respect. All the years of working against you, I felt I'd see you do something out there, I'm like, doggone, Reagan's always a step ahead of me. I looked how can we bring this together, but it's interesting over the 25-6 years of practice. I can't even remember anymore. It's been too long. But all those years, patients would come in and I'd be like, we got to get you actively moving. And patients would be in pain, they'd be hurting. And one of the biggest reasons why we don't move today is because of pain. I mean, it's back pain is still the number one reason why we go to the hospital. I mean, it is such a thing that plagues people. And I was always looking at, well, how can we get people out of pain quickly? as we put them into our program and we start trying to change the spine or posture, it was slow because they were in pain. And we'd have to tell them, hey, look at the full picture. Look down the end here. It's pain relief, but we got to get you moving. We got to get you out of pain. And then there were patients that just couldn't do it. And we were trying to find ways to really help them, reducing inflammation, their diet, doing all those things. And so sometimes I just have to, just suck it up and send them out to, a medical doctor that did maybe an injection, a cortisone injection, which I'm not a big cortisone fan. That's just not where I've always gone. But then that patient, I wouldn't see them. And I'd be like, well, dang, I sent them away. And then 3 or 4 months later, they'd come back and they'd be like, I'm starting to hurt again. I'm like, well, where have you been for the past 4 or 5 months? And I go, well, I was feeling better after that injection. I'm like, that's when we're supposed to be rehabbing. That's when I wanted you here. And then I'd get the feedback, and this did not serve a patient well. They'd say, well, I went to that doctor and he said, you don't need to go to the chiropractor. You don't need to do rehab. This injection will take care of it. And plant this seed, this wrong belief in someone's mind. And then I wouldn't see them, and we didn't. But then the pain's back and it didn't serve them well. So I started thinking, well, how can we really integrate this together? And how can we help the patient from start to finish? And so, I thought, let's try to figure out a better system. Let's figure out how can we use the best of science to get somebody out of pain as quickly as possible. And so, we put together an ambulatory surgical center where we can actually send our patients that need it to actually have some medical treatments that are the most powerful medical treatments to get them out of pain quickly, with doctors that support our philosophy and say, okay, this is the first step. So when we look at maybe an epidural steroid injection or a nerve reset using an ablation, our doctors understand that that's the first step. That's opening the door to now healing, not the end. I was talking to a lady yesterday, and she was asking what I do, and I was explaining it. And she goes, "Oh, I've had an ablation. Oh, I've had the epidural." And I said, "Yeah, but that's where you stopped, and the pain is back, isn't it?" She's like, "Yes, it's back." And so I told her our philosophy, and she's like, "Oh my gosh, that's amazing. How do I see?" It begins to make so much sense. So if we can use interventional pain, if we can use some medical science, the best out there to get a patient out of pain, but help them to understand that now all that is doing is opening a window to begin the rehab process against gravity. Start building strength against gravity. If I have knee pain, do I have foot pronation? It's turning that knee in and wearing it out. Where is the structural breakdown? If you're eating incorrectly and you have a lot of inflammation in your body, can we sit and look at your diet and help change some of that? Can we use peptides to promote health? And then, of course, the next step, well, as we're beginning rehab, it's chiropractic, it's acupuncture, it's all of these structural and neurological, healing processes. And then can we begin the regenerative process? So now can we use things that stimulate your stem cells? Can we use things that are growth factors and cytokines and all of these things that promote healing of the tissues, that are building cartilage, that are helping to strengthen muscles and tendons, that are repairing the collagen in your body. And it really becomes a process that the end goal is to have you heal. It's treating the cause of the problem, not just that symptom. But to me, then, Reagan, I think the most valuable tool is the education process through it. Because when we're done, again, when you go to the dentist, you're not done brushing your teeth. It's now, how do you maintain this for the rest of your life? What are some simple things you can do for 10 minutes every day? Or be conscious how you sit at a computer, or it's the education that then begins to change the mindset and the thought processes and the belief systems that make us act different, that then give us the quality of life in the future. I can't tell you how many patients I talk to that say, what do you want? What's your goal? Well, I want to have a better quality of life as I age. I see my parents. I don't want to be like that. And I ask them, so when should you start that process? Do we decide to have a good quality of life at 75? Or is our quality of life have to start, where we are today is the result of how we've treated ourselves the last 15, 20 years. So 15, 20 years down the road, we got to start doing those things today that are going to determine our quality of life in the future, how we eat, how we move, how we treat ourselves.
Yeah, you're basically giving your future self a favor, by you doing your exercises this morning. You're planting that seed. One of your favorite quotes is, "When is the best time to plant a tree?" Well, it was 20 years ago, right? And
It's like
if you
the
didn't
time is
plant,
today.
yeah, so yeah, then let's second best is today. And so
So I always think if I could go back, and I know that everybody should have thought of this, if I could take myself today and go back and talk to my past self 20 years ago, what would I tell myself?
yeah,
A lot of things I'd love to tell myself, right? A lot of things like, don't do that, you idiot. Or hear this, you dummy. But what if I could have my 20-year-old future self come back and talk to me? What would I want myself at? I'm 54. So what would I want my 74-year-old self saying to me today? I think about that a lot. What would I tell myself? What would I do? What would I tell myself to do differently, and start to think about that and incorporate those things into my life right now? Because life, quality of life is really based upon how we feel, right? Our energy levels, how we experience life is such a huge thing. So, I wouldn't want to live to be 100 years old if I was just laying in bed with tubes coming out of me. Nobody wants that, right?
um,
We want quality. I would love to live to be 150 years old if I knew I was moving and active. I could still swing a golf club. I could do those things. Hey,
right.
let's keep going on. This is great. I love life.
Yeah.
So
And have you ever given yourself kind of like a goal? I want to live to be 120 or 150, or have you ever set a longevity goal?
yeah, I do. It's interesting. I look at my parents. I looked at what age that they passed away at, and I think, is that something that's kind of genetically disposed there, or can I change that? Can I push the barrier? And what we know today, what we know about nutrition, what we know about regenerative medicine, peptides. Yeah, we all have the ability to extend our life. What we know now with genetics, what we know now how to protect, our DNA and all of those things. Yeah, we have the ability to live longer. So for me, if I could cross that 100 number, to me, that's like a cool mountain to cross.
Yeah.
I'm on my second marriage, and my wife is a little younger than I am, so I want to be around for a long time, and she wants me to be around for a long time. And
Yes, it
so,
does.
so yeah, hundred's kind of my number. I would love to cross that 100 mark. And
Man. Well, if I put you up against any 54-year-old dude, guarantee you're just crushing it. I mean, no one would guess that you're 54. So you've already turned back the biological clock, which is impressive. So, all right, so we got to get you there. My mentor, Dan Sullivan, who's been on this show probably a dozen times, he's got the goal to live to be 156. And
well, ask me at 90, and it'll probably be like 200 at that point. So
yeah, we'll see with all the technology. He's banking on this idea that, hey, there's some things that are coming up with stem cells, with peptide therapy, with CRISPR editing in our DNA. I mean, there's no reason why, in a couple of decades, we couldn't have the choice of how long we wanted to live. I mean, it sounds kind of creepy and futuristic, but that technology is getting closer and closer.
And that's a great important point. And I think one of the things is that my thoughts and my mindset is always evolving. If you'd asked me 20 years ago, I'd have said 85. I don't know. I'm good at 85.
Right.
But it's always evolving. My headspace is always learning and changing and open. And so yeah, I'm open to any possibility. I'm open to, and I truly believe that, you know, we used to see people retire so early. I still see people that are just crushing it in their 70s and 80s.
Oh man, so much energy. And those are people who have the real value to add because they've been through it all. They know the game from start to finish. And so they're so wise and helpful.
Yeah, the knowledge is priceless.
Yeah, when you put yourself in the retirement seat, then you know, it's just like gravity, you know, you're going to get recycled real quick if you lose that purpose.
And that's, I think we all understand that. That's a part of longevity is movement. You know, if we're not moving, as soon as we stop moving, yeah, muscles weaken, gravity crushes us.
Yeah.
It's game over.
Yeah. Well, so let's talk about peptides. I mean, you're doing some pretty cool biohacking right now with
I
peptides.
got some being delivered today.
Oh, good. They came.
No, they're coming today. I
Oh,
got
they're
them
coming
packaged
today. Okay.
and I'm like, ooh, some new ones to try.
Yeah. So I don't know if you mind of us jumping in. I know a lot of our listeners, they love their peptides and
Yeah.
man, they love it when I, you know, kind of talk about some of the science behind it, but maybe we could talk about what you've been on and then what your goals are for the next phase of care in your peptides.
Yeah. You know, my peptides knowledge comes from you, Reagan. You've been, that's one of those things. Even, you know, a year and a half ago, you know, everybody's talking about peptides. I'm like, I got to go to Reagan. Reagan's like he's the specialist on peptides. And I'll be darned if I can remember some of the names of them. You're going to have to
I can help you.
have these crazy names. And you know, I've had a history of some knee issues and just football and mountain biking, snowboarding, and all of my injuries I think have mounted from snowboarding.
Yeah.
That
Yeah.
big thing, you know, sports and trauma induced and all those things. But so, you know, the first one I ever did was the BPC 157,
Hmm.
and that really helped my knee tremendously. That was a great thing. And in fact, I've got some coming, and I'm going to put some in my shoulder. I had a real bad snowboarding injury, and always trying to keep that shoulder um, healing. I just shredded that thing. I was told I was going to need a shoulder replacement like 6 years ago, and you know what? I'm down lifting as heavy weights as I ever have. You know,
That's great.
pushing hard on that thing, and I keep it very strong. So that was a big one. I
And
started the epitalon.
yeah, Epitalon. Yeah.
I started that, and also the thymosin. Is it beta 1 or alpha 1?
Beta 4. Yeah. Well, we had you on thymosin alpha 1 in the beginning and
Now I'm starting the beta 4.
yep.
That's one that's coming today. I'm excited to get going on that one.
Yeah, that one is impressive because watch when you're working out, you know, you get the soreness.
Yeah.
Thymosin beta 4 just takes it away, where the next day you wake up and you're like, I should be sore. I really pushed it in the gym, but the soreness isn't there. It's pretty magical.
No, I love that. I'm excited for that. I'm out mountain biking every day, and I love the golf. And one of the biggest problems I have with my golf game is I work out pretty heavy and I ride hard, and then I go to swing the golf club and I'm tight. It takes me about 5 holes to warm up, and then I start swinging because I lift pretty heavy still, and I love to work out. I love to be active, and so I'm excited to not have that soreness afterwards. But then I also got the MOTS, is the MOTS C,
Might see. Yeah.
which I've always been very fascinated with DNA health or mitochondrial health, you know, and
Yeah.
really how to push my mitochondria for more energy production. You know, one of the big things, I'm a big believer in just positive thinking and driving. I've been a big Tony Robbins fan. I've been to all of his seminars. One of the most powerful things, I sat down and put all of my values together. What are my core values? And I said as my number one core value was my health.
Yeah.
And I really came to realize that any of the goals I have in my life, no matter what they are, you know, whether it's physically, whether it's relationship wise, whether it's monetarily, whether it's service, all of the things I want to do in my life, if my health and energy just sucks, I can't do anything. And really my quality of life revolves around my health and energy. So that's my number one value in my life. And so really trying to push my mitochondria to more higher energy production just means I'm going to get more stuff done. I'm going to really
Right.
be able to be more active and a better quality of life. So I'm excited to kind of try some of these new ones and that are driving some of that. So
Yeah.
there's another one that you gave me to put me on for just a little bit more, even muscle development. I don't remember what it was.
That was the CJC 1295 ipamorelin.
Yeah. So, you know, just as I'm working out, I'm always measuring my body fat and my muscle mass ratios. And you know, I'm 54. It's not quite as easy to maintain muscle as much. But you know, I'm pushing it hard. Um, you know, it always takes a good trip to motivate me, you know, to really get in shape and, and, you know, going to the beach with my shirt off. But, you know, I'm always trying to stay somewhat lean and trying to stay somewhat driving muscle. One, I just feel better, but you know, when I have a good lean muscle mass, I know my metabolism's better. I know my posture against gravity is better. And so I'm excited to add some of these biohacks that you're teaching me, just to improve my own health, to improve my own longevity. And so,
Yeah, it's exciting, and I love how you're number one when you put all your values together. And Tony Robbins is so inspiring. He's just
you made
phenomenal.
a massive change in my life.
Huge. But yeah, my core value is I'm a health transformer. So I transform my own health and then I help people transform theirs. And so, you know, if you looked at and if I prioritize, you know, what I want to do in my life, number one, you know, as you know, of course, take care of your own health. But number one is I want to be of service by transforming people's health. If you know, I don't know how to give legal advice. You know, I wouldn't recommend that, by the way, from Reagan. I don't know how to give accounting advice, but I do know how to give health advice from, you know, a different perspective. And I think
Best I
peptides, what's that?
know. And one of the best I know, right?
Oh yeah, I appreciate that. But yeah, it's so fun working with all these cool medicines because, you know, when I started my clinic, I named it EastWest because, you know, I went into Eastern medicine because it allowed me to heal from an autoimmune disease from my Hashimoto's. And I said, this is amazing. I want to be more of a holistic integrated practitioner, but I missed the sciences. And so that's where I said, all right, we want to bring in doctors and specialists who can really help bring that science component to the medicine, the Western side. And then working with you now we've just broadened that Western approach. And so, you know, now we have like this really cool holistic medicine that's ancient, you know, like chiropractic care, acupuncture, Chinese medicine, energy work. And then we have this knowledge and innovation with the complete Western side. And so I think bridging the gap has been really powerful.
Yeah, I agree with you. And, you know, that's when we partnered up, and that was part of my motivation to say, hey, Reagan, here's an opportunity. What do you think? And you're like, done. We didn't
Mm.
even have to think about it. Is because I think that, you know, looking at what I was working on, and then I was always watching what you were working on. And I always just thought, man, here we have employed with us these top trained anesthesiologists in pain management, treatments, and injections. So
Yeah.
patients come into our office, they're seeing the most educated MDs that are out there when it comes to treating pain. They're all fellowshipped, you know, and these guys have a little bit of a different philosophy looking at what we do. So we have the ability to reduce pain and then step into the rehab that's a specialized physical therapy to build posture, strengthen joints, with chiropractic, with acupuncture, but then to bring in what you bring in on top of that and add the peptides. And we were doing functional medicine, but to bring it to the level that you guys do and to incorporate that into this, that's why I said, Reagan, I don't think that there's any system across the entire country, maybe even across the world, that is as broad based and is, as you said, from Western to Eastern, and
Right.
brings that together. And if people can see that and understand it, I mean, the things that we're able to do for patients now, even the medical doctors, I love when I talk with our medical director, he's just like, when I came to work for you, I was a little skeptical, but I'm blown away at what I'm seeing here. This is incredible. And so, yeah, it's fun. It's like, you know, I wish my dad's passed away, and I wish so. My dad, when my dad passed away, my dad's last words to me, I had the opportunity. I was there when he passed away, and I you know was right by his bedside, and here my dad, who devoted his whole health to healthcare education and treating patients, and what a remarkable hero of mine. I get emotional. I talk about my dad, and I said, Dad, what do you want me to do? What is your last words to me? And my dad's last words to me were, number one, take care of your mom.
Mm.
He loved
Cool.
he loved my mom. Oh my gosh, they were in love until the day he passed away, and now even more so. And my mom has passed away now, but my dad's last dying words to me were, continue to study the progression of health and how
Wow.
to help and serve people. and get them healthy. Get them healthy. That was
Wow.
life. And so, to partner up with you, Reagan, that's your value, that's your goal, that's your drive. And to partner up, that's mine as well. And to always looking at new and innovative ways to, to, to just change health. And to me, one of the most important things is that we're constantly working with people to change the way they think.
Yeah.
I've had some of these conversations with you. I'm a true believer that our actions are governed by our thoughts, our belief system.
Mm-hmm.
Where do we get our belief system? Much of it's shaped from our growing up, the way we grew up, our experiences in life. We develop these beliefs. And there's a quote that I love, and I'm still looking for the author of this. I'm just going to call it an unknown author right now because I can't claim it, but it was so profound to me when I heard it. And it was one of the most dangerous diseases to the human mind is the power of belief. We get so ingrained in something that we believe in that we act. So if I believe that a drug is going to help me, it's going to change my life, I close off every other option out there. This is the way I've got to do this. And then, we end up going down this road, and then we see people addicted to narcotics and opioids, and they're there because of their belief that that was the right path for them, right? To me, that can be thought of as like a disease, a thought that is so ingrained that we're not even willing to challenge it or explore other options.
Yeah.
But it drives us in such a negative way. And if we look at just people's poor health in general, it's a belief that's implanted so deep. So one of the biggest things to me is, how can we change the way people think? How can we educate them and give them new knowledge to innovate their own life, to innovate their own health, to make changes that will completely change their future, that will completely help them see, new possibilities of living beyond 100 when, they didn't even think they were going to make it to 50.
Yeah.
So how can we help people see a different perspective? That to me is what gets me up every morning. That's what gets me going. That's what gets me excited, is really serving people in the healthcare industry. Not only patients, but doctors. I love nothing more to take a doctor that has such an ingrained belief and to all of a sudden blow his mind going, I've never even thought this way before. I had an opportunity years ago. I was sitting at a dinner at a big function, and I was just there, and I'm at the table. We're all having fun conversation, and I'm with this guy was sitting next to me, and I said to him, I said, so what do you do? And he goes, oh, I'm a neurologist up at the University of Utah. And I go, oh, that's pretty cool. And he goes, how about you? And I go, I'm a chiropractor. And he goes, oh, really? Like I felt like a black man back in the back of the bus in the 50s or something. That was just like the way he looked at me. I was like, and I just looked at him and I said, why, do you have a problem with that? And he went, and nobody had confirmed him for it. And he went to me and he said, wow, no, but he didn't know what to say. And he goes, you know what? I don't even think I know what you guys do. And so right there on the tablecloth, I drew him some pictures of postural breakdown, the nervous system, nutrition, inflammation, and I was just going through all this. And he sat back and went, whoa, you just blew my mind. I have never even thought that way before. And he says, we are trained so differently. We are just trained to think so differently. It just blew his mind. And he said, how do I refer someone to you? I said, well, let's just keep in touch. And we've maintained a relationship. But to take people that think in a certain way and shift their mindset, to me, is one of the most exciting things that we could possibly do. And we need to do in our healthcare system.
Yeah.
We all need to come together. I don't think any of us have the answer, but collectively we do.
Right.
And that's what integrated wellness is about.
Well, and the interesting thing about that conversation, Dr. Frogley, is that, I've seen the same thing. I said, I'm an acupuncturist, and it's kind of like, oh, that's weird. Did you learn online? I took a couple YouTube courses and I learned how to stick needles in. It's just like, there's a whole dismissal of this other side of medicine. And now what we're doing, I mean, with with the Western doctors being so much more open to the types of care that we provide. And now we're open to them. You know, we've had to open our mind. I got to be honest, like I've been skeptical about the services they provide. But the thing we have in common is we want to end the opiate crisis. No, there's no doctor out there. I mean, maybe there's some shady ones, but I'm just going to give them all the benefit of the doubt. There's no doctor out there that wants to get someone hooked on opiates. And 22% has been the increase of opiate use since 2020. And that's a big number because, you know, I had a patient of mine who was a very outstanding lawyer. He was a leader in his church. He had 7 kids, not quite your parents' 10 kids, but he had 7 kids, and he got in a car wreck and he was prescribed opiates to manage the pain. And he came to see me and I said, man, we got to get you off these opiates because he'd been on them for 3 months. And I said, it's too long. Next thing I know, he couldn't get his prescriptions refilled. He was trying to see the neurologist that I was working with at the time, Dr. Vincent, to get her to refill his prescription. He was drug seeking and then ended up getting hooked on heroin. Needless to say, he got disbarred. He got divorced. I don't even know if he's probably homeless right now. I mean, it was just devastating what it did to him. And this is someone you talk to him, you'd be like, oh, he's got 100% integrity. He was like the most gentle human being, articulate, smart. But man, when that disease, when that addiction took over, he became a different human.
Yeah. You know, it is such a sad thing. And you know, I watched my sister-in-law die from opioids.
Yeah.
Just still this beautiful, shiny person away. And, you know, one of the things that I can definitely say that I have experienced excruciating pain. You know, with my knee and my shoulder, that injury, my shoulder injury was just excruciating. Yeah, I know what it feels like to be in pain, and I get it when a patient is willing to do whatever it takes to get out of pain.
Yeah.
And the problem is we go see a traditional medical approach. And you know what? Medical doctors are there because they want to help. They have a good heart. They do want to help. And they want to help you long term. And they know an injection, the injections we recognize are just a temporary thing, but it's opening a door for us to do something. Well, for them, if we just go down that path, they know it's temporary. To help a patient long term, the only thing I have is to give them a prescription of opioids that are ongoing, and that's the only tool they have in their tool belt. And unfortunately, we know the end result of that and where that leads. And you know, that to me is one of the, if we could just even take some time to share stories, which I won't, of just patients that I know, spouses that have come into my office. Can you do anything for my wife?
Right.
Neck surgery 15 years ago, and she's on opioids, and I don't even know who she is anymore. I don't even recognize her anymore. And the tears that have been shed as we've just discussed some of this in the clinic over the 20 some plus years of practice, of just, to me, to watch what drugs rob, not just from that person, but from the family and friends.
Yeah.
Just so, yes, we are on a mission to stop the opioid and narcotic crisis that's out there.
Yeah. And the crazy thing that now we just said, well, let's go work with the pain interventionists so they actually have an alternative, right?
Absolutely.
And so our doctors are not prescribing narcotics. Absolutely no.
They're doing the injections and prescribing rehab and chiropractic and acupuncture and nutrition.
Exactly. Yeah. So what about, I mean, this, I wish I wish you and I would have done this 20 years ago, right? When we were first starting.
When's the second best time? Today. When to plant a tree.
To say we should have planted this tree 20 years ago, but 20 years in advance, we're going to be thanking ourselves, because that's where the addiction starts, is with that simple prescription. And a patient goes into it a lot of times very naive about what they're getting into. And now if we can stop that at the headway, now we change that person's whole trajectory. Not only can we get them better with our care, but now we've stopped that future that could impact generations to come. I mean, your sister-in-law, watching her die, I mean, how many people did that impact? I mean, she had kids, or?
Oh, absolutely. And yeah, the emotional impact has just been unbelievable. It was definitely such a sad process. And once you get addicted, it's hard to move away. And that's the hard thing. And so, you know, one of my favorite things that I hear in our facility, I hear patients say, finally, finally, someone has figured out how to put this all together into one place.
Mm.
And that's the thing is realizing that you know it's funny. I think one of the hardest things that we do see in our clinic now when people walk in, some people walk in still with the mindset, I just want a chiropractic adjustment, and they walk in and here's all of this.
Right.
And getting them to think differently, it really is, it really is such a mindset shift and an amazing process when you get there. But I know there's people looking for everything together, and I love to hear patients. That to me is one of the greatest compliments we get is when they walk in and go, man, why doesn't everybody do this? Why doesn't every healthcare facility do this? And
Right.
that pulled together is really a powerful thing. And you know, to be able to be involved, as I said, Reagan, and I know that this is your mission too, and to watch, as you mentioned, my sister-in-law, to watch the families, to watch the friends, to watch those. I don't know. I bet I'm willing to say this, that I bet you if I walked to every person that I know today and said, do you know somebody, a family or a friend that is addicted to an opioid or is addicted to pain medications? Yeah, I have a cousin, I have a family, we're all affected by it. It has affected our entire society.
Yeah.
It's going to take, changing one life at a time here if we can, to slowly get to a point where that starts to go away. But it's awareness, it's creating new systems, it's creating and innovating ways that, and then getting it out. How can we let people know? And then not only how do we let people know? It's how can we get people now to step up and make a change, take responsibility for themselves? Some of the biggest problems I've had over the years is just patients with the mindset that, hey, my insurance should be paying for all of this. And I'm not, if my insurance isn't paying for it, I'm not paying for it, doggone it. I'm like, what kind of thinking is that?
Right.
You're never going to get anywhere. So one of the biggest things that we have to do is help patients step up and take responsibility, whether that's the food I put in my mouth.
Yeah.
I ate at McDonald's yesterday and I don't feel so good. My bowels aren't working today. What happened to me? Well,
Right.
you ate, right? So take responsibility, whether that's, getting up and moving, whether that's the food I put in my mouth, educating myself. People have got to step up and take responsibility for their health.
Yeah.
That's when the magic begins,
Yeah.
when they say, okay, I'm responsible and I'm going to do something about it. My insurance doesn't care about me.
Yeah.
I'm just a number. I'm a dollar figure for them, right?
Yeah.
I pay all this money to them. They don't want to give it back.
Right.
They don't want to pay for it. They're going to fight everything they can. So, we'll help the fight. That's one of the neat things that we have with our interventional pain management is we do have the ability to use your insurance, and we will fight. We will hold the insurance accountable to the laws and everything we can, and we'll get as much as we can paid by your insurance. But there is some out of pocket. There is still, we've got to take some responsibility, but we do everything we can to say, okay, here's what it's going to take to help you. Here's what your insurance will pay, and here's what you're responsible for, but we're going to help you. We're going to get the insurance to pay as much as we can. But patients have got to not sit there and think, if my insurance isn't paying, I ain't doing it. I can't tell you how many people have told me that over the years. I'm just like, oh, I don't know how to help you, you know.
Yeah, I think it's a mindset that I'm seeing more and more, that people realize that being a card carrying member of society does not grant you health. You can even have a big checkbook and that's still not going to grant you health. What you have to do is take ownership, just like you said, take responsibility. That's step one.
That's another great quote that you've heard me say. It's one of my favorites is, mindset is the root. The rest is the fruit.
Yeah.
If we
Yeah.
have the wrong mindset, our life is just going to be in shambles. If we have the right mindset, the fruit is a wonderful life. It's health, it's longevity, it's enjoying the quality that we're all searching for. So it starts with this mindset. Oh my gosh, to me, in all of my Tony Robbins experience and training I went through, which was remarkable. I highly recommend that to everybody because it's a mindset. He'll tell you everything, whether it's health, whether it's wealth, 80% of it, 80% of it's mindset. 80% of it is your psychology, and 20% of it's actually what you're doing.
Yeah.
So we got to get the head in the right place before we can make the change.
Man. Well, this has just been a fantastic conversation, fantastic journey. And so I'm going to encourage each one of you, if you know people who are in pain, or if you're in pain yourself and you're not sure where to turn, well, there are other solutions out there. And make sure you talk to your friends, your family, your loved ones, because there are people who are suffering who have no idea that this type of medical care exists. And so, Dr. Frogley, this has been phenomenal having you on. What's the best way people can get in touch with integrated wellness?
Absolutely. One of the things, first of all, real quickly, is one of the things that, we find that, and I find this rarer and rarer with the system we have. But, I always tell patients, we don't know if we can help you, right? Until we sit down with you and we actually find out what's going on and really see where you're at and really understand the condition better. We always offer a consultation to come in and sit down with us, where we can verify your insurance, find out what kind of benefits you have. We can find out really, can we take your case and can we help you? Are we a good fit for each other? What are you willing to put forward? What are you willing to do? Where's your desire to get well? And just sit and figure out if we're a good fit for each other. I always tell patients right up front, if we can't help you, I promise you we will be right up front and tell you this is not a good fit for either of us. But here's my recommendation. Let's send you over here. Okay.
Yeah.
And that used to be go to EastWest, but now I had to bring that into here and join you. So that's why I said there's not many people we're going to tell them that anymore, because we have everything in one place. But we will be upfront with you. We'll be honest with you. We'll consult with you. If we can help you, then we'll say, okay, here's what we'd like to do, and here's what the cost is. Here's how your insurance will help. Here's all of this. So there's no reason not to come find out. And if anything, you'll walk away with an education. Holy cow, we have a lot of educational opportunities, videos, classes, things that we do to help you. So you can call our office at 801-816-0332. Talk to my incredible staff. We have such an incredible staff there. The patients hear that every day. We love your staff. They're incredible. And
I love them too. I came in, I'm like, man, they're heroes.
They are awesome. They are all on purpose to help and serve and get people better. I love that. So also you can go to our website. It is southjordanwellness.com. Our office is right off of I-15, just on the west frontage road north of 106 South. So you can walk out, and they built a lot of buildings there now, but I used to be able to look at Southtown Mall across the freeway to kind of give you an idea where we're at. We're right across the Front Runner station now on the west side of the freeway there. So it's southjordanwellness.com. There's ways that you can schedule a consultation there, get educational materials there. Or again, the number is 801-816-0332.
Awesome.
Look up, I got a last name, just Google Dr. Frogley. I mean, it's Frogley. How can you forget the name like Frogley?
True. Well, thanks so much for being on the show. Thanks for all your wisdom, all the work you're doing. Look forward to the future that we're creating together. So thank you very much.
We're here to rock the system, right, Regan?
That's right. Disruptors.
Disruptors.
Yeah. All right.
Thanks for letting me be on. And everybody, take some action. Get out of your chairs. Step up. That's when it starts.
Love it. Awesome. Well, we'll see you everybody next week. Same time, same place. Don't forget your hack this week. Eat protein, at least 1 pound of protein, 1 gram of protein per pound. That'd be a lot.
That may be digestive problems.
Yeah. All right. Take care, everybody.
Thank you.